Maternal mortality, as we all know, is death per 100,000 live births, death of mothers. Women are dying in the process of giving life. Anywhere where a woman dies is still not good enough. So, in Yoruba language, they say, "Agbohun iya, agbohun omo." We hear the voice of the mother and we hear the cry of the baby. It shows that, all is well. If you don't hear those voices, it means something is wrong and there is danger. So, Nigeria, 2008, survey 545 per 100,000 live births. And we also know that in the 90s, what we used to hear was either 800 or 1,000 per 100 live births and stuff like that. And up till now, we still have a lot to do in the country. Then newborn mortality is usually per 1,000 live births. In 2003, it's 53. In 2011, 39. The source is UNICEF. So in a way, when you are doing your story or you are quoting a figure, don't just say it. The source is required. So the source is very important. Credible sources. And newborn mortality, we don't need to talk too much about that. Various ways of measuring maternal mortality and newborn mortality. The data can vary greatly according to the source of the information. DHS 2008, it gives it at 545. WHO 840. WHO 2010 630. And then another source gives it at 487. You notice that depending on the source of the information, the figures may be different. But the main thing is DHS is known that this is standard globally. WHO is known also globally, but we have to look at when was this conducted? What was the source of the information? Because a number of times the source of information is from the ministry or from a government agency, which sometimes may not be accurate enough. So we have to be very careful when we are, but the standard that is used, the DHS survey is quoted widely by everybody. When you look at the number of women who die every day, 110 on the average in Nigeria. We lose an average of 110 women every day, an average of 696 babies also. So you get to the hospital for service, you get the service and all the other things. Drug, you go to the pharmacy, you don't have. That chemist, just straight in front of the hospital, you get it there. So is that free? In Kano, drugs is not available 75%. Concern no provider is available 72%. Nationally, 33% and then 41%. Everything is in the DHS. So what will people do to make sure that providers are available? What should government do to make sure that drugs are available for the people? Those are the kind of questions that we should be asking. What will you do to fulfill the promise that you made during the electioneering campaign? So Then let's look at this, adapted from DHS 2008, improve women's access to skilled health personnel. When you look at in urban centers, percentage of women receiving some antenatal care from a skilled provider. What's the percentage? In rural, what's the percentage? 46. About half of that. And the total, 57.7. Only about half receive antenatal care from skilled provider, which means we still have a problem in that line. When you look at percentage of births assisted by a skilled provider, doctors, nurses, midwives and stuff like that, how many? For urban is how many? 65. For rural, 27. Look at rural, 27, which means about, let's say, 3 out of 10 is attended to by a skilled provider. How many women deliver their babies in a clinic? Jigawa is a more rural state, just 4.5%. Kano, 11.1%. Nationally, 35%. So where do people deliver? Then why do so few women access maternal health services? You can see, concern no provider is available. Then women who receive postnatal checkup in the first 2 days after giving birth. Urban, about half, about 59%, more or less 60%. Rural, about 3 in 10. The first 2 days after giving birth. Sometimes a woman has given birth, they go home and stuff like that, and problem starts. Total is still not up to even 50% for national, at the national level. So these are some of the things that we need to interpret in our stories.